What is a heart attack and how to recognize it? A heart attack is a dire medical emergency, a situation where one of the arteries called the coronary arteries supplying the heart muscle gets blocked with a blood clot. It happens suddenly over seconds to minutes, causes severe crushing or heavy kind of chest pain at the center of the chest. Sometimes it may be left or right sided. It may go into one of the arms, left or the right, the shoulder, the back, the jaw, the neck, sometimes even the ears. Any significant discomfort which is present from the jaw downwards up to the belly button can be a heart attack. Sometimes a severe chest pain or discomfort may not happen, and there may be breathlessness, sweating, fatigue or tiredness, giddiness, a sensation of nausea and vomiting, a sensation of fullness in the chest and upper abdomen could be the only symptoms, or all of these and some of these may happen in a combination. Sometimes a person may pass out and become unconscious because of a cardiac arrest resulting from a heart attack. So if you see any of these symptoms in yourself or somebody near you at home or office or at an airport or a railway station, anywhere it may be, you should think of a heart attack and act fast. What is the first aid for a heart attack? If you have any of the symptoms which I mentioned in the previous video, or if somebody at home has these symptoms, make them sit down or lie down comfortably. Check if they are breathing okay. Check if they are conscious, if they can answer a couple of simple questions to see if they are in their senses or not. The first aid is mainly to keep them at rest and not panic. You should have the nearest hospital with a cardiology facility, the number of the hospital available, the ambulance number available. Just like buildings have a fire escape plan, one should have a medical emergency plan in case of heart attacks and other medical emergencies. That is the most important first aid one can have, and a plan ready so that in case of such emergencies it can be executed with ease, without any panic and without any confusion. The second thing is to call the hospital or the ambulance and take the person to the hospital immediately without any further delay, without waiting for more symptoms to happen or more worsening to happen or for it to get better. If the pain or the discomfort has been there more than 5 or 10 minutes, one better be in the hospital. What one can do is take a tablet of Dispirin or commonly available aspirin, crush it, dissolve in a half glass or 1 glass of water and drink it up, if the person is able to drink, because that can act as a blood thinner or an antiplatelet agent which works on the blood clot. These are the simple first aids one can do. If the person seems to be drowsy or unconscious, check the pulse, check the breathing, and if they are not breathing and if the pulse cannot be felt, start CPR. One needs to learn to do CPR in case of a cardiac arrest. It can save lives. But in first aid for heart attack, mainly it is about putting the person at ease, at rest, make them sit down or lie down, give a crushed aspirin and rush to the nearest hospital with cardiology facility immediately. If you or one of your family members or friends is having a heart attack, is having chest pain, which hospital to go to, how to go there or how to reach there and why are important. Which hospital to go? It has to be nearby. It has to have a cardiology facility with cath lab where an angiogram and angioplasty can be performed in an emergency manner. Number 3, most importantly, it should have cardiologists available round the clock in order to treat the heart attack, in order to do the angiogram and angioplasty. All 3 are important. Has to be nearby, has to have a cath lab, has to have round the clock availability of cardiologists. How to reach the hospital once you have decided where to go? you have to preferably go in an ambulance, because on the way, if you develop any problem, if you develop any complications, the paramedics and medics can attend to you and give preliminary medications, and also make sure that you are stable enough by the time you reach the hospital. They can also alert the hospital you are reaching about your arrival, so that they can be prepared to take care of you in time. Driving yourself is a strict no-no. You may develop low blood pressure, you may develop rhythm disturbances, you may black out or pass out, leading to harm to yourself and others on the road. So do not drive yourself if you are having chest pain, if you think you are having a heart attack. Somebody else can drive you in case of non-availability of ambulance. You should just be a passenger and take rest and reach the hospital safely. Why? As already explained, these are the reasons why you should choose a nearby hospital which is well equipped and has available cardiologists round the clock, and preferably go in an ambulance so that you can reach in time and appropriate treatment can be instituted. The aim when you are having a heart attack is to reach the nearest well-equipped hospital with a cardiologist available round the clock, so that your heart attack can be treated in the golden hour. The first 1 hour after the onset of chest pain or heart attack is the golden hour. If proper treatment is performed in this golden hour, including an emergency angiogram and angioplasty, the chances of survival are the highest. There is minimum or no damage to the heart muscle, thereby preserving your heart function. So this determines your long-term survival as well as your long-term health and how well preserved the heart function is, so that complications like heart failure, rhythm disturbances, and future risk of heart attack and cardiac arrest can be minimal. So it is important to reach a nearby hospital in the golden hour after the onset of chest pain. How is a heart attack diagnosed? Practically, in day-to-day life, there are 3 important tests in a heart attack. Number 1 and most important, and most of the time a diagnosis can be made, is a simple 12-lead ECG. The electrocardiogram or the ECG can diagnose a heart attack in 90% of the cases when somebody comes in with chest pain. 10% of the time, even in a heart attack, an ECG can be normal. An initial ECG can be normal, but subsequent ECGs done after an hour, done after 2 hours, what we call as serial ECGs, can show further changes confirming the diagnosis of heart attack. In addition to ECG, we perform an echocardiogram or an ultrasound scan of the heart to look at the left ventricle, to look for any evidence of heart attack. When there is a blockage in one of the arteries supplying the heart muscle, that area of the heart muscle doesn't contract properly. This is known as regional wall motion abnormality, which can be picked up on a simple bedside echo, and a diagnosis of heart attack can be confirmed. The number 3 test is a blood troponin test. Certain proteins called troponins leak into the bloodstream from the heart when there is heart muscle damage due to heart attack. These can be detected as early as before 4 hours after the onset of chest pain. High sensitivity troponins are used now, which can detect a heart attack with a very high accuracy. If a troponin test is negative, we may have to repeat the test after 4 hours. Sometimes the second test can come positive. So ECG, echocardiogram and a troponin test are used in the diagnosis of heart attack. If the initial tests are normal, you may have to still wait in the hospital for an hour or 2. Sometimes you may have to get admitted for observation to do the serial ECGs in order to do subsequent echocardiograms and troponin tests till a final diagnosis is reached. Sometimes the ECG as well as echocardiogram and troponin tests can be negative initially and may subsequently turn out to be positive. Sometimes If the chest pain is very significant and the patient is in a lot of discomfort, even if the initial tests are negative, one may have to perform an angiogram in order to rule out a major blockage in one of the arteries, which may require an angioplasty and stenting. So in case of a heart attack, if the ECG and the echocardiogram and troponin are not conclusive, meaning they are conclusively not negative, neither are they conclusively positive to diagnose a heart attack, one may have to undergo an angiogram, which is the final diagnostic test in order to rule out a heart attack. What is the best treatment for a heart attack? Like I said earlier, heart attack happens suddenly because of a clot forming within the coronary artery which supplies the heart muscle. There are 3 arteries in the heart, 2 on the left side, 1 on the right side, and these 3 coronary arteries are your actual lifeline. If any of these arteries gets blocked with a blood clot, you get chest pain, you'll end up with a heart attack. The logical and of course the best treatment which has been proven by trials world over is to perform an emergency angiogram immediately, identify the artery which has clotted with blood, and open up the artery by doing an angioplasty and put a stent so that the blood can flow back into that territory, reperfusing or supplying blood to that area of the heart back again and bring it back to normal. The earlier it is done after the onset of chest pain, within the first 1 hour, or preferably within the first 3 hours of onset of chest pain or heart attack, saves a lot of heart muscle. You may come out with a normal heart function without any damage or minimal damage. So the best treatment in a heart attack is to undergo an emergency angiogram and angioplasty with stenting to re-establish the blood flow which has stopped into that particular coronary artery territory. This is called primary PCI or primary angioplasty or emergency angioplasty, and it has saved millions of lives world over. Is angioplasty and stenting the only treatment for a heart attack? Are there any alternatives? One may not be close by to a hospital which has a cardiology facility or a cath lab, maybe in a remote place, maybe in a small city where such facilities are not available, or the hospital cath lab is occupied where the procedure cannot be performed for some reason. There may be many reasons why an angiogram and angioplasty cannot be performed immediately. In such cases, the alternative or the alternate treatment is to give an injection called a thrombolytic agent, or in simple words, a blood clot dissolving injection. Many such injections are available in the market, and the doctor may choose to give this intravenous injection, which may be streptokinase or tenecteplase or alteplase. Different varieties are available, and these will go into the bloodstream and find the clot and dissolve it. This will give relief in many of the patients, especially if it is performed in the first 3 hours of onset of heart attack, and the patient can be stabilized and shifted to a hospital which has the facility to do angiogram and angioplasty, and that can be performed either 12 or 24 hours later after stabilizing the patient. So this is the alternate treatment for a heart attack where angiogram and angioplasty and stenting are not possible, and that is a clot dissolving injection. Once the treatment for heart attack has been started, an emergency angiogram has been performed, the blockage will be identified, and the cardiologist will perform an emergency angioplasty and stenting to re-establish the blood flow. Once this is done, you will be shifted to the intensive care unit or the critical care unit, where you will be monitored for 12 to 24 hours for blood pressure, pulse, oxygen levels, your urine output. All the vital parameters are monitored closely, and you will have to take bed rest for at least 12 to 24 hours in the intensive care unit where the treatment is done. During this, your pain should subside. The pain generally subsides almost immediately after the angioplasty is performed. Sometimes it may take 1 or 2 hours for the pain to subside completely. You will be given blood thinners, you will be given medication to control the cholesterol, the blood pressure, and anti-diabetic medication if you are diabetic. You will be given a light liquid or semi-solid diet during this period depending on your condition. If the patient having heart attack is very sick, is in cardiogenic shock, low blood pressure and low perfusion of the organs, they may put you on a ventilator. You may be on additional blood pressure support medication. You may be on intra-aortic balloon pump and such devices to support the circulation, in which case more intensive care and close monitoring will be required. If the course is not very complicated and you have come out of it quickly, after the 24 hours you will be shifted to the room or the ward where subsequent care will happen. In uncomplicated cases, generally the patients are discharged on the 3rd or 4th day of admission and sent home on medication. Once the treatment for heart attack is performed and you have been sent home, life can be normal. It doesn't mean that if you have had a heart attack, you cannot perform normal day-to-day activities, get back to your normal social life and your job. It can be very well done, and there are people who have undergone angiogram and angioplasty after a heart attack and returned to complete normalcy and doing even sports and higher physical activities. Now, once you are sent home, certain lifestyle to be adhered to. Smoking should be stopped. Any form of tobacco is not allowed. Avoid alcohol altogether if possible, or restrict to 1 or 2 small drinks in a week after a month after the heart attack, not immediately. Do not drive for up to 1 month after the heart attack. You can do walking, light exercises for the first 1 week, and after 1 week when you see your cardiologist, you can discuss as to how much physical activities you can do, how much of exercise is allowed depending on your heart function and your recovery status. It is not the same for all heart attack patients. Some people may take a longer time to recover. Some left ventricular function may still be impaired, in which case you will have to go slow with your physical activities. Always consult your doctor before getting back to full normal physical activity and exercise. In this regard, cardiac rehabilitation does help in bringing back the stamina and bringing back the effort tolerance to normal in a guided and graded manner. Coming to diet, one should stick to a low carb, low sugar, low fat diet, which doesn't increase your risk further. Consult a dietitian or a good nutritionist in order to get to know what exact diet you need to follow. Medication after a heart attack and angioplasty include blood thinners or antiplatelet drugs, including aspirin, medication to control the cholesterol, that is statins, and if you have high blood pressure or if your left ventricular function is impaired after the heart attack, some medication to improve that will be given. If you are diabetic, anti-diabetic medication has to be continued, and you need to continue these as per recommendation by your cardiologist. Do not stop any of these medications without asking your doctor, because these are extremely crucial and critical in order to maintain the patency or the flow within the stented vessel. If you stop these abruptly, the stent can get blocked with a blood clot and lead to another heart attack. So be careful, do not stop these medication without your doctor's advice. Apart from this, indulging in sexual activity can be allowed after 1 week of recovery from heart attack. Consult your doctor again as to when you can resume. Avoid painkillers, especially NSAIDs or medication like Brufen, diclofenac, because these can cause adverse effects on the heart. So one can return to completely normal life if you follow your doctor's advice, if you follow a proper diet and lifestyle. Good quality sleep is important. Keeping away from stress is important, in which yoga and meditation can help to a large extent. If you suffer from anxiety and depression, do consult a psychiatrist and get treated.